Hello. Today's topic of discussion is failure to thrive. Failure to thrive is a term used when a child, especially the infant or toddler, is not gaining weight as expected. It is a clinical sign and not any specific diagnosis. I'm going to discuss in two parts. So today we'll be discussing on the definition and overview regarding failure to thrive. We'll see the classification of failure to thrive, the risk factors and the causes or the etiologies. The term failure to thrive, as I said, it is not a disease. And to define, there is no single universal definition. And this is best defined as inadequate physical growth over a period of time, which uses a standardized growth chart. Standardized growth chart means a chart which is made based on large representative population data. So examples will be WHO growth standards, CDC growth chart, which are all statistically normalized. So these charts are used to define failure to thrive. And if you see, the growth velocity is highest at first 2 years of life and during the earliest teens. So at these times, children most probably fail to thrive. But this term is usually used for the younger age group, that is till the toddler age group. Weight is the most common parameter when you define failure to thrive, because weight is the very sensitive and the first parameter which is affected during any illness. When the child falls sick, suddenly child will lose weight. So weight is a very sensitive parameter. So this parameter is usually used to define failure to thrive. If there is an unexplained weight loss or there is a poor weight gain, those are also considered as failure to thrive. And then sometimes even the linear growth, that is the height and head circumference, can be affected. So sometimes these two parameters are also seen, but mainly weight is seen. Before defining the failure to thrive, let's see what is recommended. In developing countries and developed countries, different standardized growth charts are recommended. So for the developing countries, the recommended standardized growth chart for children 0 to 5 years is WHO growth standard, which was made in 2006. This reflects the optimal growth for healthy breastfed infants. So this survey was done in multiple countries, mainly the 6 countries, where they had combined the developing and developed countries, and then they took out this chart based on the breastfed infants. And this shows ideal growth and uses Z-score and percentiles to define the growth of the child. So as per this WHO growth standard, failure to thrive is when Z-score is less than -2 SD, and this corresponds to less than 3rd percentile in the percentile chart. So if these parameters are less than -2 SD or less than 3rd percentile for weight for age, weight for height, or height for age, then this is considered as failure to thrive. So mainly weight is seen, so weight for age and weight for height is the main parameters which is considered. So this is for children 0 to 5 years in the developing countries using WHO growth standards. So just have a look at the growth chart which was made. This is just one chart I am seeing, so I am showing you. So this you will get for different age groups, for male and for female both. So this is just a female chart I am showing. This is showing the length for age girls, length for age girls. This is showing you the Z-score, and this one is showing you the percentile. So percentile lowest is the 3rd percentile. This will be corresponding to in the Z-score -2 SD. Now come to age 5 to 19 years. The growth chart, the standardized growth chart which is recommended for the developing country is WHO growth references. So that was made 1 year later, that is in 2007, by WHO, and this also uses the Z-score and percentiles, and this describes how children actually grow. So as per this growth reference, failure to thrive is when Z-score is -2 SD, which corresponds to less than third percentile, for BMI for age, that is weight for length or weight for height of the children, and weight for age till 10 years. Weight for age chart is available only till 10 years. So this can be taken, and BMI and weight for age is mainly seen. Sometimes height is also affected, so that is also seen. But mainly if weight is affected, these first two parameters, then you can say this child is failing to thrive. But this term is usually used for the toddlers, so the previous slide what I showed, that is very important. So this is just an example showing 5 to 19 years old children. This is the chart. This type of chart is used. So in this I am showing you the height for age for the boys and height for age for the boys. This is showing the Z-score, and this one is showing you the percentile. So this is for age group 5 to 19 years. So this chart also is available for girls, boys, for in different ages or different age groups. Now come to the developed countries. So for the developed countries, the recommended standardized growth chart is 0 to 2 years is same. They use WHO growth standards, which was made in 2006, which involved breastfed infants of multiple countries. They had taken 6 countries, and that was developed as well as developing countries. So this chart can be used for both countries. But in case of children 2 to 19 years, especially the developed countries, CDC growth chart is used. The CDC growth chart is mainly based on the US population. So US population, so this one is used for developed countries. So this will be not fitting for the developing countries, where the economic standard, growth, everything is different when you compare with the developed countries. So these two charts are recommended for these age groups. So have a look at the CDC growth chart. It looks like this. So this is the weight for age chart I am showing you. So here there is a percentile. So here in the percentile you can see third percentile, you can see fifth percentile also. So when they define the failure to thrive, they use fifth percentile, not the third percentile. So according to American Academy of Pediatrics, AAP, the definition for failure to thrive will be weight for age less than fifth percentile in standard growth chart on multiple occasions. So when they say this, they are meaning CDC growth charts. Above 2 years, they are using CDC growth chart. So if you use that chart, the definition will be weight for age less than fifth percentile in the standard growth chart on multiple occasion. That means on more than one time occasion over a short period of time. Or it may also be defined as when the weight drops 2 major percentile lines. So if you see in the growth chart, either from 75th to 25th, or as you see in this chart, 25th to 5th. So this is 25th and this one is 5th centile. So 2 major percentile, if the weight drops that way, then in more than one occasion over a short period of time, then also this can be considered as failure to thrive. There are certain exceptions. Genetically short stature, where only height is getting affected, so this will be exception. This is not called failure to thrive. If the child is small for gestation age, for this child their growth stature as well as weight will be lower to their peers, so for them that will be normal. So these are exclusions. This is not failing to thrive. That will be normal for that child. And when you are using or checking the preterms, then you should always plot using the corrected age. So for the preterm babies, you have to take up the corrected age and then do the plotting. So until 2 years of age, you have to do the corrected age in a preterm child if the birth weight is was more than 1000 gram, and if the birth weight was less than 1000 gram, then till 3 years of age you have to take out the corrected age for the preterm infant and then plot. So corrected age I'll teach you when I am teaching about the preterms. Catch-up growth for premature infants, for head circumference is 18 months, for weight is 24 months, and for height or length is 40 months. So till this age also you can use this also till the catch-up growth. So for these parameters till this age you have to take out the corrected age. Now come to the risk factors for failing to thrive. There are certain medical risk factors and then psychosocial risk factors also. So medical risk factors can be prematurity, intrauterine growth restriction, developmental delay, congenital anomalies like cleft lip palate where the child is unable to suck, intrauterine exposures to alcohol, anticonvulsants or lead poisoning, and malabsorption. So these can be risk factors for failing to thrive. Psychosocial risk factors can be poverty, certain beliefs like fear of obesity, or if the parents don't know and they keep on feeding the child with breastfeeding, so exclusive breastfeeding for a prolonged time. Exclusive breastfeeding should be done till 6 months, but sometimes parents don't know, so till 2 years they go on continuing with the exclusive breastfeeding and not give the other feed. And then social isolation is another risk factor, life stresses, poor parental skills, and then disordered feeding techniques, and drug or substance abuse or violence. So these can be psychosocial risk factors. Now come to classification of the failing to thrive. One is number A, it can be classified traditionally. So traditionally it is classified as organic failure to thrive, which comprises 20%, and then organic is the secondary to underlying medical problems or medical illnesses. Non-organic failure to thrive, so this is 70%, so more causes are due to non-organic cause. So here there is no disease, but there can be psychosocial failing to thrive, psychosocial factors affecting, or nutrition. So inadequate food or undernutrition will be the cause for failing to thrive, and this is the commonest. And there can be mixed failing to thrive. So in the mixed varieties, the organic causes may be mixed with the non-organic cause. So if a child is having a disease, some cardiac disease, will also have a psychosocial factor associated, then this will be mixed failing to thrive. So when you take a history, you can find out. Another classification is based on the energy balance and pathophysiology. So it can be due to inadequate calorie intake, it can be due to inadequate absorption and increased loss, it can be due to increased calorie requirement. So this will be based on the energy balance. Now come to the causes. Since psychosocial cause is more common, let's see the causes for psychosocial failing to thrive. The commonest one is inappropriate nutrient intake. So inappropriate nutrient intake can occur when there is insufficient lactation in the mother, if the child is having cleft lip, nasal obstruction, adenoid hypertrophy or dental lesions, child is unable to suck properly, and then if there is a sucking or swallowing dysfunction due to CNS or neuromuscular disorders, and if the child is taking excess amount of juice and inadequate quantity of food, that is imbalance in intake of food, that also leads to failing to thrive. And sometimes economic factors like poverty or food insufficiency in the family or house will lead to the failing to thrive. Other psychosocial causes can be poor parental skill. Parents don't have the correct appropriate knowledge regarding sufficient diet or feeding techniques or appropriate way of making feed or formulas for the children, baby. They might be giving too dilute formulas, and sometimes food refusal by the child. And if there is a child abuse, neglect, there will be failing to thrive. Some family stresses like marital stress, single parent family, divorced family, mental illnesses in the family. If there is alcohol or substance abuse in the family members, then this may also affect the child socially. and if there is a emotional deprivation in the child. There might be sibling rivalry, or there might be partiality by the parents, so all these might lead to emotional deprivation, leading to failing to thrive. Now come to the organic causes. The cardiac cause can be congenital heart diseases or congestive heart failure. Any chronic illness can be the cause, and any respiratory chronic conditions like severe asthma, cystic fibrosis, bronchiectasis, bronchopulmonary dysplasia, adenoid or tonsillar hypertrophy, or obstructive sleep apnea. Gastrointestinal causes like pyloric stenosis, gastroesophageal reflux, malrotation, malabsorption like cystic fibrosis, celiac disease, lactose intolerance, milk allergy or food allergy, biliary atresia, cirrhosis, and sometimes due to pancreatic insufficiency syndrome, which is usually occurring with the cystic fibrosis, inflammatory bowel disease, chronic cholestasis or chronic diarrhea, short bowel syndromes. So in all these conditions, sometimes there is deficiency of absorption, or sometimes there is excess vomiting, and then due to all those conditions, and there might be enzyme deficiency. So all due to all these conditions, this gastrointestinal cause of failure to thrive can occur. Now the causes, that is neurological causes like cerebral palsy, hypothalamic and other CNS tumors, neuromuscular disorders, neurodegenerative disorders. Here also child is having repeated problems, and they have swallowing problems, so they are unable to feed or eat, and then sometimes many times they have disuse atrophy because they cannot move properly, activity is less, so there can be atrophy and there will be not gaining of weight. So those can be cause for failing to thrive in neurological causes. In the renal cause, recurrent urinary tract infection, renal tubular acidosis and chronic kidney disease can be the cause. Some endocrine causes like diabetes mellitus, diabetes insipidus, hypothyroidism, hyperthyroidism, growth hormone deficiency, adrenal insufficiency, hypercalcemia can be the different causes. So in these conditions there might be polyuria, polydipsia, so they are taking excess of water but less of calories, so those will lead to failing to thrive. In growth hormone deficiency, growth hormone itself is less, so the growth is affected in height, weight, in all the aspects of growth, it is affected because of the growth hormone deficiency. Now come to genetic metabolic congenital conditions like sickle cell disease, inborn error of metabolism like organic acidosis, hypoammonemia, storage disease, galactosemia, fetal alcohol syndrome, skeletal dysplasia, chromosomal disorders and multiple congenital anomaly syndromes. So they have metabolic problems which is leading them to not thrive properly. So they cannot gain weight properly because of the metabolic problems. And some miscellaneous causes like collagen vascular disease like SLE and GIA, malignancy and primary immunodeficiency. Infections like perinatal infections like torch infection, occult or chronic infections in the body, parasitic infestations, tuberculosis and HIV. So in all these conditions a child fails to thrive. Okay, thank you. Next class we will do the approach, how you should approach to a child to diagnose the cause for failing to thrive. Thank you.